Welcome to the Slop Temple. We pray this video helps.
In this video, I will explain how to take vitamin B12 injection. Prepare your space and supplies first, then verify your prescription and dosage. Clean the injection site, draw the correct amount into the syringe, and inject using steady, confident technique. Dispose of needles safely and document the dose and time. If you feel unusual pain or symptoms, contact your provider promptly for guidance and follow-up. Gather everything before you start to make the process smooth and safer. Inspect the vial for clarity and expiration, then clean the top with an alcohol swab. Use a new sterile syringe and needle, and keep your sharps container nearby so you can dispose immediately after injection. Having a mirror or helper can improve accuracy. Calm breathing and a relaxed muscle will make the injection easier and less painful. Select the injection site your clinician recommended and expose it fully to work comfortably. Clean the area, then use consistent motion to insert the needle at the proper angle for intramuscular or subcutaneous injection. Inject the medication steadily and wait a few seconds before withdrawing to reduce leakage. Apply gentle pressure and a bandage if there is minor bleeding. Monitor the area for redness or swelling over the next day or two.
Thanks for watching. Consider subscribing if we helped you.